humfmradio.com. Humfmradio.com. Jagat, welcome back to the studio. I know you were missing last week when the elections were going on.
For 3 weeks.
Did you have to rub that in?
No, but
I was away for 3 weeks, but it was a pleasure to be back.
Yeah, I know.
Last week,
I mean, everyone needs
you.
some time off.
Yeah,
right?
you absolutely did.
Yeah.
I needed to, but you definitely needed it. And it's going to be a great show again today, as we had. Our last show was really awesome. It was all about elections.
Right,
And
right,
our first hour, we're going to be doing our usual educational shows that we do on Open Forum. Because our show is all about teaching other people, listening to other people, talking to other people. We've been doing this for the last 21 years now. Folks, and we really want to thank you all for listening to us Saturday after Saturday. And if, God willing, we'll keep doing this for decades to come, if we can do that, right,
Very
Jagat
true.
Bhai?
Yes.
And today we have a great show, as usual. I've never said our shows are bad. Our shows are always awesome. But today it's going to be even more better. So we have, as you know, folks, we have partnered with IACAN, which is the Indian
American Cancer Network.
American Cancer
Network.
Okay. All right. Look at that. I learned something else today. And we partnered with them in the past. We talked about other cancers. Awareness is, like, for example, we did the breast cancer awareness not too long ago. And I'll tell you what, when we step out of the studio, and being Desi, Saturday kai party to hoti hai. So when we go to a party, the people always say, "Hey, you guys were just amazing on your guests were really, really good." And I'm like, why didn't you call then? He said, we don't need to call. You have all the information, the question that we would have asked. Y'all are asking, because Jagat and I have been doing this for a long time, and thank God we know what to ask you, right? So it is amazing how many people listen to us. The last we know, it's anywhere between 55 to 75,000 people listen to us on Saturdays, and we really appreciate all those listeners out there. Because of you, we do this show. And so today, on behalf of, in partnership with ICANN, we're going to be bringing to y'all folks from ICANN. And I'm going to introduce both of y'all. I see the introduction is amazing and it's really long. So I'm going to make it really, really concise and short, and not taking anything away from all your achievements in life, basically. But I'm going to start with, again, ladies first. So I'm going to start with our young lady out here. I had the pleasure of meeting Mitali Paul a few months ago at the ICANN Gala in Fort Bend County. Let's put it this way, in Sugar Land. And what a gala y'all had. Fantastic gala. And y'all collected a lot of money for a really, really good cause. And ICANN does a great thing. And we're going to talk about ICANN in a little while. Hello, Mitali.
Hi.
And I want you to tell me a little bit about yourself, and then we're going to go to Dr. Tariq out here.
All right. Thank you so much for having us here this afternoon. My name is Mitali, and I serve on the advisory board for Indian American Cancer Network. That's not my full-time job, but I'm very passionate about it. And thank you for mentioning the gala. We actually have a strategic planning retreat tomorrow. And we're actually
in Hawaii. No, I'm just.
I wish, but Mona Lisa won't allow us to spend all that money that you helped raise in the gala. Yeah. But it's actually in Fort Bend again tomorrow in Sugarland itself, and we have the boards coming together for a retreat tomorrow. That's to awesome. Kind of make plans for 2023.
Fantastic. And welcome.
So what exactly, Mitali, do you work, though? If this is not... give us that information,
Sure. So I'm the department administrator for surgery at Houston Methodist in the medical center. And I also teach. I'm adjunct faculty at the Texas Women's University.
Wow.
Mitali
right in the neighborhood, huh, there?
Yep.
Spraket du Deutsch?
Not really. I was a year old when my parents moved back to Germany, to India from Germany.
So she was born in Germany.
So you were born in Germany?
Yes, I was.
But then raised in India. And then you moved to, land of milk and honey. And here you are right now. Right? There you
so
go.
there's no Dankeschenk?
No,
not really. Not really. That's probably the only word I know.
And of course, our second guest is Dr. Nabil Tariq, who is the medical director at the bariatric surgery at Houston Methodist, again in Sugarland. In Sugarland, is that where you
I
are?
work with Mitali at the medical center as well, and at Sugarland both.
Because my office is right next to the building out there. That's why I say I used to go make rounds out there a few years ago. You're also an assistant professor of surgery with the Cornell Medicine Medical School. I guess that is. You guys are attached to Methodist. It's amazing. You did receive your medical degree from one of the most prestigious hospitals in the world, really. IACAN University Medical College in Karachi has fantastic. I know so many of my physician friends from there. They're just amazing people. So congratulations on that also. And then, of course, tell us a little bit more about you, because I probably messed it up.
No. Thank you for the kind introduction. I want to thank Mitali for having us here, and thank you for having me. Today's topic is of interest to me, because although I'm a bariatric surgeon, an important aspect of that is lifestyle medicine, and so as we talk to patients about their health all day, and though we do surgery to help their weight, that affects all aspects of their life, and so because of that aspect, and even its effects on cancer specifically, Mitali asked if would be willing to come and chat with you guys about that, and I think it's a good nexus for the topics.
Are you on the board of IACAN also, or as an advisor?
But I'm interested in helping out, and I'm interested in helping out and becoming part of it. Yeah.
Fantastic.
Before we go into it, how is the situation in Pakistan right now regarding the flood situation? The latest,
Right. It's the waters have mostly receded. The issue is going to be, which will be magnified, is mostly inflation related. A lot of crops have been destroyed.
Right.
So that's going to
Housing
be the next.
have been destroyed.
Right. So a lot, and of course, it disproportionately affects the lower income people. So that's going to be, unfortunately, the next phase of sort of humanitarian aid in terms of basically food. Food prices have skyrocketed.
Yeah, that's sad, but
so
hopefully things will get better.
Yes.
Well, getting back to our topic, folks, as you know that cancer prevention, this month is Gastric Cancer Prevention Month, as we have designated several months in a year to a certain cancer. A couple of months ago, it was breast cancer awareness. And if you remember, Jagat Bhai, we had a lot of our guests from IACAN were here, and we had a fantastic show. And before that, we've had some other shows about hematological cancers also. So today, we're going to talk about cancer prevention. Cancer treatment is a total different game. But how do you prevent things from happening is equally important, or maybe sometimes even more important. So we're going to talk about that. And as you know, Dr. Tariq, we have, in primary care, we do a lot of preventive medicine. Part of that is certain cancer that can be detected in early stages or even before they are, really bad, like breast cancer or cervical cancer, or colon cancer, prostate cancer, etc. There are several others, and we can detect them very easily if people just come and get their well check done and have a physician who has been checking them and doing things. And that's what IACAN promotes. That we partnered with Rose Clinic to do our breast cancer preventive measures. We provide free coupons.
Mammograms for uninsured and underinsured women.
Exactly.
And last year we did 10 women that were able to get free mammograms through IACAN.
Right.
And we continue to grow those programs and look at how we can, part of being here today talking about gastric cancer or other types of cancer, talking about diet and lifestyle, which are things that we can impact, because genetics we can't really change or impact, but diet and lifestyle are two things that we can impact, and we know those three things are the main factors for cancer, any type of cancer.
And you're right, and it's the environment, that we live in, and part of the environment is how you behave in the environment. For example, if there's a lot of food out there and you go grab it and eat it, that is the environment that you have control of. But like you said, there are certain things you just cannot control. So we're going to talk more about preventive. Now, you are a bariatric surgeon. Can you explain what that means in lay terms to our listeners
Sure.
out there? वो कहेंगे कहाँ से लेके आए? Bariatric क्या होता है? Yeah.
The bariatric surgery is it's a better term these days called metabolic surgery.
Wow, I like that. Okay.
And because it affects your metabolic health, and we know that obesity, unfortunately, is increasing significantly. Over 30% of Americans are obese, likely, and over 50% are overweight. So, what surgery, bariatric surgery is in the spectrum of treating obesity, which, of course, is lifestyle change, medications, etc., and then all the way to interventions and doing surgery for that by cutting the stomach smaller or rerouting the intestine as part of some of the surgeries is what bariatric surgery is.
Now we know, Jagat Bhai, that if you don't smoke, that is a preventive measure that we
Yes,
have in several
yes.
cancers, but primarily the lung cancer we talk about, right, etc. And there are other things that you can avoid doing to prevent colon cancer and bladder cancer, etc.
Right.
Why then where does this obesity prevention come into play when you talk about cancers?
Sure.
And not only that, how obesity can be not maintained as such, but can be reduced, because a lot of people are going for bariatric surgery at certain age, thinking that, listen, we are not going to be able to lose any weight or control the diet. So that needs a behavioral change. For whatever reason, it just doesn't come easily.
Behavior change is obviously one of the hardest changes to do, and as far as cancer risk and obesity is concerned, so first of all, cancer overall is increasing. Partly environmental, partly maybe obesity related, as we'll talk about in a little bit more, but also we're living longer. With age, our repair mechanisms, protective mechanisms against cancer decreases.
Agreed. Right.
So as we live longer, just with the improved healthcare systems around the world, cancer is going to, and we've all been either touched by it personally or one of our close family members. And so at the same time, the World Health Organization says they've looked into this, that almost 30-40% of the cancer burden of the total cancers may be lifestyle related. And though a number of them are smoking related or alcohol related, but obesity is a very rising cause or associated with cancer. And that includes very common cancers, from breast cancer in females to GI cancers, such as colon cancer, even to some degree gastric cancers. Pancreatic cancer are associated with obesity.
Really?
Yes, significantly
Wow.
increased.
Are there certain cancers that have a more predominant because of obesity, or is it just a generalized?
Majority are increased, but the ones specifically that are increased are esophageal, colon, breast in postmenopausal women especially. A lot of the fat cells produce estrogen. So
Right.
even when
Wow.
their own
Yeah.
ovaries quit producing estrogen, the fat cells produce estrogen, and thus that exposure is maintained in a prolonged
So
exposure.
the breast is
So postmenopausal breast as well as some of the GI cancers that we mentioned. Endometrial very much is associated with obesity, the uterus cancer
Right.
for females, and if you look at the waiting room of a surgical GYN surgical oncology clinic and our clinic, it's not too different.
Okay. दोस्तों हम लोग आज हमारे स्टूडियो में we have a lot of Hindi and Urdu speaking listeners, and sometimes I break into my broken Hindi and definitely broken Urdu and try to convince people that hey, we are with you, right? तो मैं क्या कहना चाहता हूँ कि आज का जो प्रोग्राम है उस पर हम थोड़ा एम्फेसिस देना चाहते हैं कि जो ओबेसिटी है, जो मोटापा है, जो ओवरवेट बंदे होते हैं, उनकी कैंसर होने की जो चांसेस है काफ़ी हाई होती हैं, और डॉक्टर तारिक हमारे साथ बात कर रहे हैं. तो आपको अगर क्वेश्चन पूछना हो तो आज हमें 1-888-749-1035 पे फ़ोन कीजिए. अगर आपको कोई सलाह लेनी हो, डीप सलाह तो दे नहीं सकते, बट सुपरफिशियली कोई दे सकते हैं, और बाद में किसी ने अगर अपॉइंटमेंट लेनी हो तो डॉक्टर साहब का नंबर भी हम देंगे. लेकिन आज का प्रोग्राम फर्स्ट आवर जो है ओबेसिटी यानी कि जो ओवरवेट होते हैं लोग और कैंसर का जो कोरिलेशन होता है उस पर आज चर्चा करने वाले हैं हम. थैंक यू वेरी मच. आवर नंबर अगेन इज 1-888-749-1035. So in your own practice, Dr. Tariq, being a bariatric surgeon, how much are you concentrating on cosmetic bariatric surgery where people come and say, hey, listen, I want to do this.
Right.
So do a surgery versus how much are you thinking that, this is really going to prevent some types of cancer? I mean, are surgeons even thinking that, or are you the only one I know that who's thinking that way?
So along with that, when someone comes with for a bariatric surgery, when you open them up, do you see some kind of an indication that this particular patient could become cancerous at a later date? And do you find those kind of cases in your surgery?
Sure. So when they come to cosmetic, so if you want to call it cosmetic bariatric surgery, if there is such a term, would be considered for patients who are out of criteria that are covered by Medicare guidelines and widely by many societies and experts. So we don't do much of that. Ours is mostly all medically indicated ones.
Gotcha.
So they have significant obesity. We use the measure as imperfect as it is BMI frequently, and above 35 or above 40, and so we do know that each 5-point increase in BMI above those levels can increase your it's like esophageal cancer rate by almost 50%.
Wow.
So these are not small increases. Endometrial cancer by 50%, postmenopausal breast cancer by 12%, or kidney cancer by 30% even. So these are significantly...
So each 5. So BMI 35, then 40, 5%, then 45, 10%, and then etc., etc.
Right. Well, for the small, some of the other cancers can increase by 100%. So, for example, a rising... speaking of GI cancers,
Right.
this rising cancer in the GI world that is increasing several fold is esophageal cancer.
Okay.
So esophageal gastric, but esophageal cancer. And in the past 40, 50 years ago, it used to mostly be a different type of cell called squamous cell. Nowadays, it's frequently what's called adenocarcinoma, slightly different cell. And that cell is frequently in the setting of chronic heartburn, acid reflux, and that's called Barrett's esophagus. And so when we screen these patients, we actually screen them all with an endoscopy for GI, and a number of them, their Barrett's esophagus is higher, which is explained why the esophageal cancer, because Barrett's progressed to esophageal cancer.
Yeah.
Wow.
And is it... when we see them first, are we primarily thinking of cancer? No, but it's definitely a secondary, because the large studies of bariatric patients that have been published, the most benefit is or any weight loss in general, even non-bariatric. The biggest benefit, of course, is in what you would expect: less cardiovascular deaths, less strokes, less events, over 50% reduction, greater than 50% reduction. But if the second most benefit in deaths, mortality, is from decreased cancer risk when you follow bariatrics. Patient who had significant weight loss for the next 10 years. So that's an important aspect to...
Do insurance companies consider that? Because, insurance companies, some of them dictate what surgery they're going to pay for.
Right.
Do y'all...
So if they meet criteria, many insurances now cover it. But think of it this way. All the long-term insurances, large employers, so the hospital systems, energy companies with whom the employees stay longer.
Correct.
So on average, it takes 3 to 4 years to break even for the insurance company on the cost. And the smaller companies, employees or people change their insurance every 3 years.
Yeah, and the insurance companies are quite aware of the bigger insurers versus the smaller.
Right. Yeah. So the ones that all the bigger, including the government insurance, Medicare, Medicaid doesn't pay for a lot of things.
No.
Pays for surgery because
Because you don't expect that in a kid or on some other.
Well,
No,
Medicaid is all over now. You can
Right.
even adults get
Adults,
Medicaid.
yeah,
like adults get Medicaid.
and, Medicare for older or disabled, Medicaid for non-affording people,
Correct.
And so adults as well. So for them even more, because if they're diabetic, they're at increased risk for various things that improves health.
I would like to make sure we let our listeners know it's not as easy as we are talking in this room out here of getting bariatric surgery, or maybe I'm out of line when I say that, because when we get our patients into, for, again, the criteria we talked about, morbid obesity, diabetes, hypertension, high-risk cardiovascular, we say, look, we've tried everything. Let me send you to a bariatric surgeon. But what I get back is, man, they've got to go through a lot of stuff. Can you give us, because it's not as easy as switching the light off or on.
And some of that is by design, as you know. We'll hopefully expand on the lifestyle medicine part of it. That those changes are important. Surgery alone can't do it, and surgery helps in starting off, giving a turbo boost to the lifestyle change. But the lifestyle change is important, and so the education by a dietitian, the psychological counseling for food-related behavior, we like it or not. For example, sugar intake has been associated with increased cancer risk. The more sugary drinks are now, is that an isolated sugar effect, or the fact that those patients are generally more obese and eat poorly?
Habits are different.
But that is increased, and so sugar addiction is no different, in my opinion, than any of the other addictions: alcohol, smoking, etc. Maybe not as strong an addiction to some extent, or arguably even as strong. It's harder to get off, but it's the same. They will go through withdrawal and stuff. So those aspects are important to touch upon to make it a holistic approach.
So if I have a BMI of 40, just pretend I don't. By the way, I want to tell all my listeners, there's some people listening, my BMI is barely 24. I'm pretty fit, I think. But if I have a BMI of 40 and I come for this surgery, give us the steps that I would have to go through till you take me to the operating table and said, "Iska bhi katte hain."
Iska bhi katte hain. Kata PT time. Yeah. So you have an initial consultation with the surgeon. We go over the qualification, risk benefits. We have you see a dietitian at least once, and then there's a pre-op diet class on top of that, and then everyone gets psychological counseling. Depending on the insurance, it may require 3 to 6 months of dietitian visits as well.
Wow. Okay.
And then we screen all our patients for GI precancerous lesions. So we do, if they haven't had a colonoscopy, they get that, but certainly upper endoscopy for looking for, obviously we're operating on the stomach, so we don't want to see precancerous gastric lesions or esophageal, because that's increased in obesity. And so and then we meet them again in clinic, kind of go over everything again, make sure that they're comfortable, that we feel they're appropriately educated on what the next steps are for long-term success, and then they can proceed.
And then, what kind of surgeries do you do? You obviously choose the patient.
Right. We tailor it to the patient, but there are surgeries such as the gastric sleeve that mostly cuts the stomach only and makes it into a banana-type stomach, and then there's a gastric bypass, which makes your stomach smaller, but also slightly bypasses your upper small intestine. And the reason these are called metabolic surgeries, these days a drug like Ozempic, called semaglutide, is very common, and not just for its anti-diabetes but obesity effect.
Right, very popular.
Very popular. Yeah. So these surgeries work some of them work exactly like that, because when food goes directly into the small intestine quicker, the GLP-1, which is what those Ozempic drugs stimulates, gets released. And so that helps in satiety. So these are some of the things that metabolically change that makes it. So how does that make it easier to make the lifestyle change? It's like going to the supermarket. what happens when you go hungry to the supermarket, right?
You're buying everything.
Or to Raja
Right?
Sweets.
Yeah.
To McDonald's or anything.
Yeah, it's like, भाई साहब ये भी दे दो वो दे दो और बहन जी वो मिठाई मत भूलना.
Exactly. When that happens, then, but when you go on a full stomach, you are much more likely to get healthier things. So this is the same thing. When you're less hungry, it's easier to make the lifestyle change.
But why, let me ask you, all three of you, why there is so much of craving when it comes to food, any place that you go to, and if you like that particular food, the aroma itself says, okay, I know that I should not buy it, but I'm going to buy it a small piece, and by the time they decide on a small piece, they order a large fries,
That's why you don't go. You go a little hungry, but not too hungry.
Right. So why this kind of things happening, and why in the initial stages people don't really take care of it? Classic example is me here. I was quite obese at one time. As a matter of fact, in college, I was called a stick.
Stick, okay.
Okay.
And now what do they call you?
A gosh, you have seen me, right? How much I ballooned and then how much I lost and all this.
Yeah, you lost a lot of weight.
I lost a lot of weight, right? But I still need to lose. So that is what I'm talking about, that behavioral change, that, hey, something you really love it, but you can still control it,
Yeah. Well, unfortunately, a lot of these, whether it's McDonald's or these, a lot of fast food places especially, they're designed to, big profits. So without getting too much into the industrial side of it, but just health-wise, both the sort of fatty, salty food and the sweet foods, there's definitely an addictive quality to them. And so I do tell patients who want to make these changes that you have to accept that this is an addiction. And then you have to change your frameworks, just like any smoker would, that it's okay, you will get cravings, you will, but that also doesn't mean you can never have it. There is a concept of cheat meal.
Right. Once in a while you can cheat.
Yeah, it could literally be once a week or even twice a week you could do it. But you have 21 meals in the week, right? If 2 are bad, that's not going to make that much of a difference.
Right.
So Friday night, Saturday night, enjoy.
Yeah. So today's Saturday, thank God. But I'll give you my just experiences with my patients and with me, how I have dealt with, making sure you keep that BMI where it is, right? You got to think of stomach as a muscle. And that muscle, just like your biceps, you can exercise and get them really big. Same way, if you exercise your gastric muscle, you can make it really big. And then it needs more and more and more. As the volume as the volume is big in the stomach, you need more for the satiety. And we talked about the satiety earlier on. How do you then, and that's where these medicines work, the Ozempic and the Mounjaros of the day, and they do take that satiety away. The gastric emptying gets changed, it changes. So when the gastric empty time changes, you don't feel like eating. You want to eat. There's a buffet out there. You take 1 or 2 things and you're like, I'm full already.
Right.
Same way, in my belief is that if it's the first 2 weeks, which you got to be very drastic. You can change the muscle of your stomach. I'm going to say shrink it, but it's not really shrinking it.
Right.
It does get smaller. And you can do that by eating much less than you always do. 2 weeks is all it takes.
Right.
The week number 3, you will automatically start eating less.
Right. I agree.
Number 2, when you go to desi parties, which we're going to go tonight, I think, what I do, and this is my trick that I tell my patients, I eat a lot of kaju or badam before I go. Kaju and badam is good for health, by the way. And it has fat in it. Yeah. When you have fat in your stomach, you get less hungry, and again, the gastric emptying time changes completely.
Yeah, but those things contains a lot of oxalate, okay? So when it contains oxalate, all of a sudden people with kidney diseases, they would think twice eating those kind of things.
Cashews and badams, try today. They will not do you any harm. I mean, we are talking of a whole tin, man. We're talking of a few.
Yeah, I definitely agree with nuts are a very important part of both not weight control, but also health in general. There are even European large studies that show, when they've done nutrition studies, that specifically since we've been talking about cancer as well, that, and again, it may be directly or indirectly related, but when they specifically look at those patients who eat nuts and those that don't, cancer risk is decreased in those that eat more nuts.
Interesting.
In general, health
General,
overall
okay.
is better, less cardiovascular. It's a good type of fat. Yeah, on a few patients, if they're oxalate, etc., they may be, but for the majority of patients,
Right.
And they have a very satiety promoting, and sometimes a delayed satiety. You know, you tell someone, muthi bar, handful of badam khaye, lekin, and after that handful, they may still be a little hungry.
Yeah.
But just distract
Time.
yourself, give it a little time.
Yeah, and that
The trouble with the desi food is in the party,
Yeah.
when you go there, there's a lot of appetizers.
Oh, I didn't
You know.
tell you my third principle.
Hold on,
Do
hold on.
not eat appetizers
Okay.
at all.
And
Samosa
then-
and pakoras are-
and then-
I know. How can you resist that?
That's why. That's
How
why you.
can-
That's
if-
why.
if
That's
there
why
is
you
a
eat
samosa
badam.
out there.
Yeah, that's why
how
you eat-
can you not eat a samosa?
And how can you eat
मुंह बंद
less,
कर
not
दो।
just one, but more?
More than that. बातें करते रहो तो उसको time नहीं मिलेगा. But that's why these cashews help you, because you when you look at
Yeah.
that samosa, you're probably going to think
Yeah.
that. And the fourth principle in our Desi buffet line is don't start from the beginning, start from the end. Do you know what Desi buffets keep at the end? Salad.
Salad, हाँ.
सबसे पहले नान भी उधर होगा, but सबसे पहले all the oily stuff will be there. End में उधर के घास फूस उधर पड़ा है. I usually skip the line, go there
Yeah.
first, and then come back and
That's my
stand at the
wife's
line.
favorite.
Yeah, so you fill
लाइन
your
से
plate.
निकल के फिर देर बहुत लगेगी.
देर लगती है. खाते रहो. Salad ही खाते रहो. Well, we're going to turn our attention to Miss Paul out here, Mithali. Paul, tell us about IACAN and when did it come into existence, and how it is focusing on cancer prevention in the community that we all deal with.
Sure. So it is a 501c3 nonprofit organization, and it was actually started over a decade ago, a decade and a half. It's been in existence for about 15 years, if I'm not mistaken. I used to work at MD Anderson Cancer Center, and that's when I got exposed to the organization. There were several employees and research scientists, as well as healthcare administrators that were involved and had come together to create this organization called Indian American Cancer Network. And Anu Rao, Gayatri Kangovi, these were some of the founding board members.
The original.
Yes. And I knew Anu from MD Anderson, and I got pulled into it, and definitely was a very, very rewarding experience for me to be a part of the founding board, create, my husband got pulled in. We created the very first website for the organization. And the intent for the organization is obviously to have conversations like what we are having today.
Right.
As you know, cancer has a big taboo. We, as the Indian American community or as the South Asian community, we don't necessarily talk about cancer, and we tend to not really, share if you're going through something like that, whether someone in our families or any loved ones. So the concept of the organization was to, one, create a network to be able to talk and increase awareness, to be able to create a support network, a resource network. As you know, there's lots of psychosocial needs that individuals go through. It's not just the disease, it's not just the patient, but the entire family that goes through. So if it's a young mother that gets diagnosed with cancer, you have to think about the impact of that on the family, the children, the husband. If it's a man who gets, and he's the primary breadwinner, then again, the impact of that on the family. And most of the treatments, as you know, there's, it's long term. You have to go through, a lot of emotional, physical, social impact that cancer has on individuals. So IACAN focuses on trying to put together resources and help the Indian American community to educate, to provide resources. We've done, research in the Indian American community. We've partnered with MD Anderson on specifically cancer research, because what we also realized is data is very hard to find, especially ethnically diverse and specific data. So if you had to, even if we were to ask Dr. Tariq, what is the most prevalent cancer amongst Indian Americans, it's very hard. You have small studies here and there, but it's very hard to pinpoint data that really trickles down to that specific ethnic population. So a couple of years ago, there was a research study called SANA that IACAN partnered with researchers from MD Anderson, and we did that.
Wow.
You talked about breast cancer screening, providing mammograms to individuals. The other big part that ICANN has been involved in is bone marrow drives. As you all again know, it's very, very hard to find a match for people of South Asian descent if you need a bone marrow transplants. And so just being able to increase the awareness and letting people know that all you have to do is it's a cheek swab, and the chances of you getting the phone call that you're going to be selected and matched as a donor is very, very little. But even being able to increase the number of donors in the registry, ICANN has played a really significant role in that. In fact, we got a leadership award back in 2016 because of the organization's efforts in increasing the number of people in the registry and being able to, again, educate people. So lots of great, educational. We also have a panel of oncologists that serve as second opinions. So we get calls from India, we get calls from across the globe, across the U.S., where people have gotten diagnosed with maybe a rare form of cancer, and they're wanting to get expert opinions. They're wanting to know, what can we do? Are there treatment options or clinical trials that are available in the U.S. or somewhere else that they can go to? Or, this is what my surgeon or my oncologist is advising.
How do y'all do that? Just because y'all have a panel that
Yes, we do.
it?
Yes. And so people will reach out. You have a call line, you have an email address, and then people will send us a message, and we get them connected with one of our panel of, and these are all volunteer oncologists, just putting their time together for us to be able to reach out and talk to people and give them a second opinion. So those are, and then, we've done yoga programs. We have a strong survivor network, because the other part of it is not only when you're going through cancer, but also long-term survival, right? And then being able to maintain and make sure that you continue to have a cancer-free lifestyle, and you're able to make sure that you don't, so we have a survivor network that meets regularly, and they do different programs. There's also, and last but not least, I want to mention spirituality, which also plays a big part in anyone's healthcare.
Sure.
Whether you're religious or whether you're spiritual or not, invariably when you're going through a life-threatening disease like cancer, people tend to look on or depend upon their spiritual beliefs or turn to their spiritual beliefs. So being able to even work with hospitals and health systems in the Houston area to provide them with spiritual resources for patients that are inpatient and maybe want a priest or maybe want to access a Gita when they're in the hospital. And, so just different ways of being able to support the community and just letting them know that, they're not alone in this journey.
Fantastic. And to your point, when I was, the ICANN gala that we did 2 months ago, that was the first time I came to the gala, and the first time I did an auction for y'all. I've done it for many organizations out here. I had the privilege of doing it for y'all. It was so much fun, by the way.
It was.
But what I saw that day was an amazing thing about the bone marrow transplant recipients and the donors in the same room.
Yes.
And that really was an eye-opening, experience of mine. I mean, you see, here's a person who gave his bone marrow to this child or adult, and both are in the room alive and shaking hands and hugging each other. And, I think that entire room that day was like, wow, look at this. And so congratulations to IACAN. The question that I get sometimes from my friends is, does IACAN also help us with treatment when we don't have any money or resources or other things? And I think the answer I've given them is y'all are more tuned into screening or helping screen. But now I did learn from you that overseas patients, if they need a consultation via telephone or Zoom, y'all do help them, and that's amazing.
Yeah.
What is a telephone, a good telephone, if someone is listening out there and say, you know what, two things. One, I may be using your services one day or the other. Or number two, even better, when they say that, hey, you know what, these are the festivals that we all live for. Eid, Diwali, Christmas, whatever. And at that time, sometimes people become a little generous and say, you know what, I want to write a check to an organization like yours and say,
Absolutely.
on behalf of so-and-so, I want to send $1,000 to you. What is a number or a website that people listening out there? By the way, Desi folks are extremely generous. And when it comes to helping things like that,
Absolutely.
they quietly open up their wallets or write a checkbook. And I hope someone listening here will send you all some donation so you can help others out there who really I need. Right? For example, I'll give you an example, and then I'll take your number. I was in my office maybe about just before the gala, actually it was, and there was a patient of mine. She'd never had a mammogram, and the son said, "Look, I can't afford it. First of all, she's undocumented, so I'm scared to go to a hospital or other place." Which I told him you should not be, because no one asks you whether you have a green card or a blue card or
Exactly.
whether a pink card. I don't care what card it is. And secondly, I told him, dude, why didn't you ever tell me that before? Because there are resources available that we can do. And I actually texted Mona right away. Mona Lisa, the president, and she texted. I wasn't shocked, but she texted me right away. She said, "I'm sending you a voucher. Here's the telephone number to call.
Yes.
Tell this lady's son to call. We will get him to the Rose Clinic and get a mammogram done for this person." So I was like in awe of what happened. That in those 10 minutes, I'm like, I'm coming there. We're going to raise a lot of money for y'all, which we did, I think.
Yes, you did.
And I was so happy to be part of it. So what's the number or a website or a email where people want to write? Like Jagat, he's got a big pocket there.
Yes.
And he'll write you a check, you know that.
Yeah.
So tell us the number.
I'm going to get the check today before I leave. You're on air. 75,000 people are listening, Jagat. So you got to give us that check.
He's very generous. He does that. I tell Jagat, we have this gala. Can you please raise your hand when I...
Yeah.
He said, I just put my hand there. Just do it for me. Don't worry. So tell us your number. Who should we call?
Sure. So you can reach us at 713-370-3489.
Okay.
It's 713-370-3489.
Right.
Our website, there's, forums. You can contact us. Even if you want to talk to someone, get a second opinion, our website is a wealth of information. It's IACANnetwork.org. So IACANnetwork.org. So it's ICANnetwork.org. And then our email is also the same one. It's ICANnetwork@gmail.com. So it's pretty easy to remember, or even if you just Google search and type in Indian American Cancer Network, ours is the first website that's going to come up on the search. And so, definitely we'd love to hear from anyone. And you mentioned, are there treatment options? Yes, we are still a small organization. There's, certainly, in fact, in tomorrow's strategic planning retreat, we're thinking about, are there opportunities for us to support in some form or fashion, some treatment, or provide some funding to uninsured or underinsured, or even partner with some of our nonprofit clinics around in the area? Like at Houston Methodist, we partner with Legacy Clinic, we partner with Hope, we partner with San Jose Clinic. We're looking for ICANN as well. We're looking at opportunities where if we're able able to partner with some of these other nonprofit organizations that are actually providing treatment and care to
Yeah.
be able to support that. Or even looking at, can we do something in India? Because
Yeah.
the dollar, obviously converts
Yeah.
to
Goes a
a
long
different
way.
rate.
Right.
Exactly.
Well,
So,
the other suggestion, again, I'm saying it on air, but maybe you could take it back to your board, is partnering with the Hotel Association in Houston. We have a big, vibrant hotel association. I'm coming to why. A lot of out of state
Yeah.
patients who come out there who can barely
Yes.
make it,
Yes.
monetarily,
Yes.
need place to
Accommodation.
stay, accommodation.
Yes.
And Jagatbhai, as
And
you
they
know,
already provided. Yes, many of them, they do provide.
and
the
they do.
facilities.
But I'm
Yeah.
saying this is the connection.
Yeah, we
between,
can-
you know,
we can
you
make
have
it-
with MD Anderson, you have with Baylor, whatever.
Yeah, yeah. We
But
can
we
make
have
it
an
happen.
organization here that can actually,
Right.
put them together and
Well,
say,
one
look,
time
we'll
I
do
think
that.
Mittal need to come here and we'll invite SEMA people and
Yeah.
maybe they can, join hands together.
Well, I think we should tell Mr. Patel, Hasu Patel, to get in touch with Mithali and then and Hasu. You know Hasu,
Of course.
Man, okay. Let me tell you about Hasu. One day I didn't know Hasu that well that he knew all these things. One day we were at coffee and I said, Hasu, yeah, I want to go to a cricket match in Florida. He said, how many tickets you want? I'm like, you can do that? Do you remember?
Yes.
I said, can you do that? I said, yeah.
Yes.
Jagat, Dinkar and I, we wanted to go.
Yeah.
2 days later, I got the connection and we paid for the tickets, but it was difficult to get those tickets.
Right.
Yeah.
He
Yeah.
made it happen. So
Yeah.
what I'm
Wow.
trying to say is there are stalwarts in this town here, in our county and our state who can make things happen.
Hasu knows everybody.
And
in the
Hasu is one
town.
of them, but there's so many others.
Yeah, but so many others.
I'd like
That's
for you
awesome.
to just connect with the Hotel Association. We'll get you the number
That's
if you
a
want
great
to.
idea.
And,
Thank you.
and do that. And I'm going to go. Thank you so much for so much information you gave. I'm going to go back to Dr. Tariq because we have about 7 more minutes in this show. 1 hour goes really fast out here. How can people get in touch with you when they do need services like you provide?
I think that they
For
can
your clinic.
simply call our Department of Surgery at Methodist, and it's 713-441-5141. And then 713-441-5141. And then if you just go into the Methodist Department of Surgery website, they can find us as well. They can just put in Methodist and weight loss, and both the whole weight management center, medical side, surgical side, everything can come up.
Can they usually do a self-referral or do they have to have...
They can usually do a self-referral.
Self-referral and then
Fine,
come
yeah.
in. And is there a big time period before they call and they get in? Or is
No, we try
just-
to, we hope to have most patients seen within 2 or 3 weeks of them calling. At least that's our goal. And so sometimes because people are away, doctors, etc. But in general, we try to certainly within a month and stuff. But hopefully,
See, as a
sooner.
doctor, you may not even know, someone called because, the front office.
Yeah, those are always
let's
challenges.
not go there.
I won't go there.
I leave that to
Let's not
Mitali.
go there because I'm his administrator and he has a lot to say about that.
Yeah, we sure do. Are there other preventive measures you were going to tell us about?
Yeah, so I think both, whether it's the American Cancer Society or American Society of Lifestyle Medicine, etc., there are certain important aspects that for overall health, but also cancer prevention that are
tell us that.
helpful. So we've talked some already about the obesity-related, weight-related, but almost independent of that, being physically active, because you could still be overweight and be active, and you could still be normal weight and be inactive.
Yeah.
So just being physically active of walking, there's no magic number, 8,000 steps, 4,000. Most,
Oh, it
some
was
is
just
better
pulled
than
out.
nothing.
Yeah,
I don't believe that.
So,
Somehow
but
there,
the more the better.
Yeah.
But that's a really important aspect, and it could just be as simple as walking.
Or I call it a half an hour brisk walking every
There
day.
you go.
Absolutely.
There you go.
Eating what we call a healthful diet, and that may be easier for our South Asian community, our Indian community, in terms of eating a lot more fruits and vegetables and more what we call plant-based
I
foods.
guess it applies to the entire South Asian countries.
Yes.
This is.
Unfortunately-
I'm sure that in Pakistan also probably you see a lot of deep fried food and
That's the
obviously-
problem. It can be just being like here. There's a big push, promote being vegetarian and vegan. So that's good when it's healthy. But if it's a pakoda or a samosa, then not so much. So
There goes my tonight's.
there goes my limiting, of course, limiting alcohol consumption and not having tobacco related products, and then eating a diet rich in sort of whole grains, fruit, beans, lentils. And
Yes.
and nuts is an important aspect of this. Limiting processed meats, especially for gastric cancer, we feel, or GI cancers. Burnt meats, especially red meats, but even other meats, charcoal grilled chicken tikkas and stuff that are really grilled and
Well
stuff.
done or
Well
something,
done. They release substance called heterocyclic amines and stuff, and those all can increase cancer. And then limiting sugary drinks as well. And so these are some things that all promote health overall. Then
Agreed.
the last aspect is sleep and stress.
There you go.
And that is absolute key.
Right.
The longest living people in the world are from what they call the blue zones of the world, from various places as diverse as Japan, Okinawa in Japan, and Icaria.
Yeah,
Greece,
even though they
and-
keep on eating rice.
Yes,
Right? Yeah.
the carbs are not the enemy.
They sleep well?
Yes,
they
carb is
sleep
not-
well.
right.
They have good personal relationships. They eat together
Right.
frequently, and they have moderate. They're not marathon runners. Moderate general walking, like you suggested. And so these are important and not stressful.
Yeah.
Eat plenty of vegetables and fruits and fresh, not things out of a package.
Basically, what you are saying is eat less.
Eat less. Eat less.
And eat less and eat right.
It's the quality
about-
You
and
don't
the
have to fill up
quantity.
your
both.
stomach.
Like a car, like mileage. You're assigned, if you whether you believe in God or whoever, you're assigned a certain amount of. One guy in my village in Pakistan once told me, and I was like, this makes sense. He's like,
Yeah.
you're assigned
A certain,
a certain amount of food in your life. you go through that quickly. Time out.
Okay. That's so awesome. I'm going to use that line. आपको एक ट्रक दिया हुआ है,
ट्रक दिया
वो
हुआ है।
ट्रक कितना टाइम में खत्म कर देगा?
Exactly.
खत्म करो. Fantastic. What a great conversation. So that preventive, of course, prevention is always better than cure.
Right.
And those preventive measures, if you think about it, so much common sense, and yet it's
Right.
very uncommon to have
very
common
common
sense. Yeah. So this is an amazing conversation we've had, and again, our listeners out there, we talk about preventive measures and getting your preventive care taken care of. In females, for example, the pap smears, the breast exam over age 45 or 50, colon cancer screening, and other cancer screening. And the lifestyle, smoking, moderate to less drinking,
Right.
daily exercise, as you talked about,
Exactly.
keeping yourself well hydrated.
Yeah.
Sleep becomes a problem because everyone lives in a very stressful life. But yes, getting good amount of
Right.
sleep is very important. Sleep apnea is one of those things that we talk about where people don't get sleep. They think they're sleeping, but they're not sleeping. And there's so much we can go on and on and on. And yet we will not finish the show, right?
Right. Absolutely.
And for
Absolutely.
South Asian, heart disease is very common in
Exactly.
South Asian
Yes.
people.
You're right.
And these same lifestyle changes can greatly reduce.
Exactly.
We hear about young, they see men especially, but even women dying of heart attacks.
Premature, yeah,
Very
premature death. I mean,
Very true.
in the 40s and 50s,
Yeah.
we've seen so
Yeah.
many.
Very true.
In fact,
Yeah.
and lifestyle changes can change a lot. People do
that is
talk
true.
about
Yeah.
genetics, but there's also an environment involved which
Yeah.
you can change and have
Live like your
in
grandparents.
America,
basically.
probably
That's
for
what it
whatever
is.
reason,
Live
there is
like
a lot
your
of fatty
grandparents.
food being eaten in America.
Yeah, it's
Of course,
available.
It's available, but now I think that there is a change. People are so careful right now. If you really look at it, some of the consumption of those items have really tremendously gone down.
Right.
And they are making all kind of changes in their food so that their business can go on.
Excellent. Okay, so the first hour is over. We're going to start the second hour shortly,
Sure.
but I do want to give you all the opportunity to for IACAN